So there is some sun hypersensitivity that's out there, and some people get hives, some people start sneezing. I think that there's intensity matters for those people. So in many of my patients who are super sensitive to light, if they have chemical sensitivities, light sensitivities because of whatever medical problems they're having, or just us being so much indoors with our lux levels at 100 to 300, when we walk outside, our retina needs time to get adjusted to 500, 10,000, 30,000. On a summer day, you can have a lux of 100,000. And so those brighter, intense lights during UVA, so remember, the respect to the sunrise to the earth is where you get a lot of the changes. So imagine this is the earth and this is where the sun is. If the sun is like basically if the sun is basically at below the horizon, that's daybreak. Daybreak light will never hurt anybody. Moonlight will really never hurt anybody. You can't have the intensity. There's not that much intensity happening. Sunrise on a clear day without trees, maybe 500, but on most days it's between 100 and 500 lux. That's also very low intensity. And remember, in sunrise, there's a lot of red light, so it's very anti-inflammatory. So that blue light, which is maybe the one that causes more of the problems, and the UVA and UVB are small nanometers, so they're more intense. They affect the skin. They give you the coloring. Those are the ones that are a little bit more intense and maybe cause more harm. So what I suggest to people when sun is rising, right? So when it's like sunrise is about say 7:30 and then an hour later will be UVA. So early UVA is so healing. It's so beneficial for us. That's around 9 o'clock in the morning. Really tough to get sun allergies from that. I would say maybe try for a person who has those symptoms, I would try tiptoeing your way into it. Go out at daybreak, go out at sunrise, go out at early UVA, and then kind of get your body adjusted. Maybe avoid 10 to 2 because that's where the UVA, strong UVA is from 10 to 2, 10 to 5. And then UVB starts pretty much during the day too. So those are the more intense lights. So for those people who want to get the benefits of circadian rhythm, but they can't tolerate direct light or high lux times, you can go out in the mornings or you can go out in the early evenings around sunset, and that will be fine. I have some patients who just can only tolerate moonlight, and they'll start with moonlight and then they're kind of working their way to daybreak and sunrise.